Hello, everyone. I'm Dr. Naim Alkhouri. I'm a transplant hepatologist and the director of the Fatty Liver Program at Arizona Liver Health. Over the next few minutes, I would like to discuss with you the topic of pediatric non-alcoholic fatty liver disease. And these are the objectives for my talk. First, I want to discuss some misconceptions regarding pediatric non-alcoholic fatty liver disease. The biggest misconception is that fatty liver disease does not affect children and it only affects adults. The other misconception is that NAFLD does not progress in children, so there is no need for treatment because it's a benign disease, so we only need to focus on weight loss. And this is in fact not true, and we need to treat in certain patients with pharmacologic treatment. And then the last part of my talk, I'd like to discuss the management of pediatric NAFLD in terms of diagnosis and treatment. So NAFLD is the liver manifestation of the childhood obesity epidemic. Unfortunately, in the United States, obesity affects 35% of children and adolescents. They're considered either overweight or obese. And obesity is associated with several illnesses, including fatty liver disease, but also things like cardiovascular disease, hypertension, high cholesterol, type 2 diabetes, and even depression and asthma. So obesity is associated with multiple illnesses, including fatty liver disease. Now, we know that fatty liver disease is common in adults. We estimate that globally, about 25% of all adults are affected by fatty liver disease. But we also have data in pediatrics and adolescents, and this is from an earlier study that looked at the prevalence of suspected fatty liver disease in US adolescents, and they compared the 1980s to 2010, and they show an exponential increase from about 4% of all adolescents having fatty liver disease in 1988 to now 11 to 12% being affected. And we have other studies that showed that the global prevalence of pediatric NAFLD is about 3 to 11%. So roughly speaking, 1 in 10 children will have fatty liver disease. And when you look at obese children, it could be as high as 50%. The other misconception is that fatty liver disease does not progress in childhood. And the picture you see in this slide is for a patient of mine that I used to take care of at the Cleveland Clinic in Ohio. And you can see all the snow in the background, but she is a 13-year-old who unfortunately progressed to liver cirrhosis from fatty liver disease. And she was actually reported on in a story for Time magazine. And when they're looking at these kids with fatty liver disease, they had so many other illnesses like type 2 diabetes, hypertension, sleep apnea, that their bodies were like adults in their 50s and 60s, and these kids were on multiple medications. And one of the conclusions from that story was that obesity is turning a generation of children into adults, basically, aging them before their time. So this is very unfortunate. In terms of studies on the natural history of fatty liver in children, this is a study from the Mayo Clinic that followed 66 children with fatty liver disease up to 20 years. And they showed that actually children with fatty liver disease have decreased overall survival compared to the general pediatric population. And 2 patients required liver transplantation in their 20s. So fatty liver disease, although rare, it can progress to end-stage liver disease in early adulthood. This is from a study that we published a few years back looking at liver transplantation for fatty liver in children and young adults. And we went all the way to the age of 39. And the idea is that if you needed a liver transplant when you're 30, you probably had fatty liver disease since you're 10 or 12 years old. And we showed that in the United States, we've done actually several liver transplantations in children and many in young adults before the age of 40. And it seems like this percentage is increasing. So between 2001 and 2011, there was a significant increase in the number of liver transplantations done in, again, children and young adults, and this is very concerning. So how do we manage pediatric fatty liver disease? One thing we have is that we need to screen for fatty liver disease in high-risk groups. And actually, the American Academy of Pediatrics, they recommend that we screen with liver enzymes, so blood tests to check liver enzymes, what we call ALT or sometimes AST is another liver enzyme, and that we should start measuring these at the age of 10 years in children who are obese. And we define obesity by having a body mass index above the 95th percentile for age. And then in children who are overweight, so this is body mass index between 85 to 94 percentile on the growth chart, if they have other risk factors such as type 2 diabetes or family history of fatty liver disease. So all these children should be screened by doing a blood test to check their liver enzymes. And then if the liver enzymes are elevated, that would be suggestive of fatty liver disease. So how do we confirm the diagnosis? We do a liver ultrasound that shows that the liver is more bright than usual, and this is indicative of fatty liver disease. As I said, blood tests such as ALT can be suggestive also. And then we have a new test called FibroScan, and this is a sonogram-based technology, but it gives you two numbers. The first number in blue that you see here is the amount of fat in the liver, so you can actually get a quantity. And then the number in orange is basically the stiffness of the liver, and that tells you about the scar tissue or what we call liver fibrosis. So very informative test, and it's FDA approved. We can use it in children, typically around the age of 10. You can start using FibroScan if they weigh more than 35 kilograms. So this is something that can be used definitely in adolescents as well. How do we manage fatty liver disease? We need to start with lifestyle changes. In adults, we recommend a certain amount of weight loss, but sometimes in children, all you have to do is to maintain their weight for a couple of years, and they could be in a good range after that. And I like to give them easy things to avoid. I always say no sugary drinks, no chips, no candy, except for rare occasions, and avoid fast food restaurants. And sometimes that's sufficient. In adolescents, you can recommend a specific diet if they are receptive. We also have medications that can potentially treat fatty liver disease in children. And this is from a study we call the TONIC trial, which stands for Treatment of NAFLD in Children. And this trial, they randomized children and adolescents to receive either vitamin E, 800 units once daily total, or metformin, which is a diabetes medication, at 500 milligrams twice daily, or placebo, so this is a sugar pill. And the idea with using vitamin E that it's an antioxidant and decreases basically oxidation or oxidative stress, which is not good for the liver. And then metformin is a diabetes medication that sensitizes the liver to the actions of insulin, and it may decrease the amount of fat. In this study, they treated these children for 96 weeks, and they actually did a biopsy, liver biopsy at the beginning and then at the end. And they wanted to look at reduction in that ALT number, which is the liver enzyme, after 96 weeks of treatment. And although initially there was a more significant reduction with vitamin E in the ALT, at the end of the study, it was similar to placebo, so that was not very effective. But when they looked at the biopsy in terms of improvement in fatty liver and decrease in inflammation in the liver and liver cell injury, it seems like vitamin E was more effective than placebo. And based on this, now we recommend vitamin E in children that have fatty liver disease, but they also need to have inflammation, evidence of liver cell injury. And it seems like it might be effective in these children. And it seems like once you see reduction in ALT, that predicts also what children will benefit from vitamin E. So we can monitor these children by checking their liver enzymes in the blood. We don't have to do multiple liver biopsies. More recently, there was a trial that looked at the effects of low free sugar diet versus usual diet. So basically, they avoided sugary drinks, things that contain high fructose corn syrup. And they randomized the children again to usual diet versus this diet low in free sugar. And it was a short-term study, so it was only 8 weeks. They did an MRI scan to quantify the amount of fat at the beginning of the study and then at the end. And they also checked the liver enzymes, that ALT number. And they showed that when you used the low sugar diet, that the majority of these kids had significant significant reduction in liver fat, and they also improved their liver enzymes. So it seems like this is a diet that is effective, and it's very simple. So again, you just decrease the amount of free sugar in the diet. So what is the take-home message? Number one is that children can be affected with fatty liver disease. This is important to know, and it's 1 in 10 children, so it's not rare. It is rare for fatty liver disease to progress to cirrhosis or the need for liver transplant in childhood, but this can actually happen in early adulthood. So it's very important to diagnose this condition early and treat it. Children at risk, such as those with obesity or type 2 diabetes, should be screened with liver function test and ultrasound. In addition to lifestyle changes, it seems like vitamin E can be used in children that are at high risk of progression, those with inflammation and more aggressive fatty liver disease. And the last message is that we do have actually some clinical trials testing new medications to treat fatty liver disease in children. Thank you for your attention.